Okay, we're going to look at the muscles that are responsible for metacarpal phalangeal flexion. So it is, and also phalange flexion or finger flexion. So we're looking at the metacarpal phalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. And so these muscles are the flexor digitorum profundus and the flexor digitorum superficialis. And so just to note, the profundus, the deep, goes to the distal phalange, as we can see here, right? The tendons going all the way to the distal phalange. And the superficialis goes to the middle phalange. And notice the tendon comes down and it splits, one side going to one side of the middle phalange and one part of the tendon going to the other side. So all of these superficialis tendons split, and it's a really interesting design. So let's keep this going. So I'm going to highlight in blue, that is the superficialis. So you can see the split tendon with the profundus tendon going underneath. And that is basically a retinacula. So it doesn't need to have additional tissues in our fingers, right? You don't want your fingers to be too bulky. So they can do all kinds of fun things like detailed surgery and artwork, etc. But this split tendon of the superficialis creates a retinacula for the profundus, the extensor or flexor digitorum profundus. And so when you flex at the proximal joint, that tendon will not kind of pop out. Some different images. So flexor digitorum superficialis goes to the middle phalanx. Again, it's a flexor, so it's coming off the medial epicondyle of the humerus. It's a metacarpal phalangeal and a proximal interphalangeal flexor. And also, since it's anterior to the wrist, it is a wrist flexor as well. The profundus goes all the way to the distal phalanx, or the distal phalange. Remember, its retinacula is basically from the flexor digitorum superficialis tendon splitting. And it is coming off, I would still say, the medial epicondyle. It's a little lower, but just for simplicity. And the medial half of this muscle is the ulnar nerve. So the other muscle is the flexor carpi ulnaris, which is ulnar nerve, and the lateral half is median nerve. It flexes the metacarpal phalangeal joint, or your knuckles, your proximal interphalangeal joint, your distal interphalangeal joint, and since it's anterior to the wrist, it is a wrist flexor.